Hi there, Dr. Keri Chiappino here. Today we're going to speak about ADHD and sleep. I hear this all the time in my practice. My child has focus problems, they have attention issues, and they just don't sleep. They either have a lot of trouble falling asleep, staying asleep, or when I go into their bedroom, their sheets are all over the place. It looks like something exploded in the middle of the night in their room. It's just that they are all over the place. They're totally not sleeping soundly. Now, there are a lot of factors that can affect children sleeping, and there's certain things that we can do to help their environment to get a good night's sleep. Things like making sure they don't have any electronics or any screens before bedtime, because the LCD screens can really wake up the brain, and that's the last thing we want. Also, we can try to really wind them down with maybe some reading, making sure they're not having any sugary foods, and also, of course, completely eliminating any of these energy drinks or caffeinated drinks that are really bad for the kids. So that's something to address. But sometimes the cause of the sleep disturbance is actually dysregulated brainwave patterns. And that's one thing that we look at with BrainCore. With BrainCore, we do a QEEG where we evaluate different parts of their brain and see where they're having any kind of brainwave dysregulation. And some kids with ADHD, in fact 85% of them, have these sleepy brainwave patterns in the front of their brain. And typically they're put on stimulant medications when the parents are choosing that for their child. And the stimulant medications, guess what? They speed up the brain, so they might really help the focus and attention. But if you're speeding up the brain, what else is going to happen? They're not going to be able to shut it off when it's time to go to sleep. And when it's time to go to sleep, guess what? When we're sleeping, our brain does a lot of cleanup. Our brain converts short-term memories into long-term memories. So having restorative sleep is super important. So if you find that your child has ADHD and has sleep disturbances, BrainCore might be able to help you. Come in for a QEEG, have a consultation. We'll do a complete examination, full history and consultation, and we'll be able to tell you whether or not we should be able to help. Thanks for tuning in, and we'll see you next time. Bye now.